Hello again, I'm Dr. Nunez with Living Health. I sometimes get asked a question about stress and what can one do about stress? What are the strategies of dealing with stress in life? Stress is one of the pillars of lifestyle medicine, decreasing stress specifically. Lifestyle medicine is that area of medicine that focuses on your lifestyle, on what choices you make on a day-to-day basis that can impact your health and your well-being. And yes, stress and reducing stress is important for your health and well-being. Stress less. So what I want to leave you in this particular video, two items that you could look at on managing your stress today on a day-to-day basis. And it's just little tasks, but I think if you do just these two very specific kinds of things, it may help you. It's just one component. Stress is elaborate, but it may help you start to refocus and start to shift over towards reducing your stress and gaining some enjoyment in life, which stress gets in the way of. Stress also produces issues with blood pressure. It makes you more susceptible to illness. It hits your immune system. So there are a lot of good reasons that you want to reduce stress in life. So what are these two things? If you're going to drill down to just the day that you're in, I want you to identify something that you enjoy, that you find pleasurable, that you think you can get something done today that you really want to do. It could be something related to a hobby. It could be planning for a trip or a vacation. It could be planning some task that you would like to accomplish, whether it's cooking related, whether it's exercise related, or sports related, or social, that you're meeting friends. But something that you think, okay, this is something I'd like to enjoy and that I would like to do. And what part of it can you do today? Can you perhaps effect a plan today? Can you take an action today to move in the direction of something you're enjoying? Can you complete part of a task that gets that further goal that you're going to enjoy done? Can you initiate planning your vacation? Can you send an invitation to a friend for a lunch or a dinner or a coffee? These little things that are tasks, it's a task that you're assigning to yourself about something that you enjoy and want to get done. So the first thing is really identifying what it is that you enjoy. And the second thing is identifying an action item that you can do today. So if you do those things, you'll start to notice how your day might shift, and you refocus then onto a more positive track. It's very important when you're starting and you're trying to shift if your days have been stressful or if you're getting caught in negative thinking. One of the things about negative thinking when you're confronting difficult situations is that you do have to acknowledge, okay, the situation is difficult or something negative has happened. But you also have to have that capacity to say, yes, this has happened, or yes, this is going on, and I'm going to move on for that. You acknowledge it and then you move on. And these 2 pointers that I'm giving you today are how you can start to shift and moving on in the day you're in today and get past it. This is just one component. It's just little tasks, little tips that you can do here or there. Yes, there are many other things that encompass stress and that you can do with your lifestyle. And they include, yes, getting regular exercise will help you manage stress. It will help your body get over it. It will help you with your sleep at night. Making sure you are getting good quality rest at night for sleep is important. And we have videos on that, on decreasing your wind down period and getting your same 7 to 9 hours of sleep at night. Very critical. Also avoiding certain substances. Sometimes caffeine, if you're drinking too much caffeine, can actually add to your stress. It gets you agitated and anxious and jittery, and that contributes and builds to stress. So sometimes backing down on those things can help. And any other substances that might be getting in your way, whether it's tobacco, smoking, or anything like that. Those are things to eliminate as well. And the other component that I've been mentioning is also being connected socially. So it could be that you're reaching out to loved ones, you're discussing things with friends and associates and family members, and those kinds of things also contributes to reduction in stress. But those are the other components, the other pillars of lifestyle medicine, and you can use these different pillars to work on a pillar where you're having difficulty with. But today I wanted to leave you with those two little action items. Identify something you enjoy, that you find pleasure in, that you take pleasure in, and identify a specific task you can take today in that direction. I'm focusing on that. With those two things, you can get started and shifting that mindset into a more positive light. If you like these kinds of videos, press that thumbs up, press that subscribe button, press the little bell for further notices, and please leave a message. It's always appreciated. So until next time, I'm Dr. Nunez with Living Health. Bye-bye.